So,
Listen,
yes.
Can you say here the average stay is less than a year?
Yes.
How many families, or how many foster care situations is a child in? Is it like 3?
We're going to talk about that in placement stability. Actually, I'm going to give you some information about
Because
that.
I
Yeah.
remember, just this statistic, less than a year in foster care, but that's not how it works.
Yeah, so we've got some, placement stability is actually, we'll jump ahead a little. Placement stability is one of those areas where I think we need to pay some attention and actually do some work there. It might be something worth focusing on if you guys take an interest. Real quick on the foster care dynamics, and Aaron, I will ask you to cut me off because I've lost total track of where we are.
Yeah, we got started early, so
Okay.
we bought time.
Okay, good. Because I'll fill it. If there's an audience and I've got something to say, no, I'm just kidding. I'm just happy to share the information.
Keep billing.
Someone, yeah, right? I'm an academic, we don't bill. So the foster care dynamics, let's talk a little bit about trends over time, just as we did with the CPS dynamic. So importantly here, a couple of things. One, that kind of thicker purplish blue line there at the top shows the overall population in foster care. And again, this goes from actually 1998 data all the way to 2013 by quarter. So you see a trend line over time. The thin red line there shows removals and the fluctuations of removals over time. The blue line that's thinner there, and I'm sorry that's really not that distinct of a color difference, but you can see the sort of thinner line below, that actually represents discharges. And by way of real quick math, but this should make sense to you, anytime you see that removals exceed discharges, you're going to see a corresponding uptick in our overall population, right? You're going to net an increase, rough math, but true. So you can kind of see how those dynamics interplay with that top line there. And then this black line represents that 6-month re-abuse rate, which is some of the kind of a different slice of the way we've been talking about that safety piece. But I really want to focus on those top 3 lines. In 2004, some of you may have observed in that earlier CPS data, a real strong effect, right, in 2004. Here's some of the explanation, and these things across the CPS system and foster care, there are some things that explain that. And it's something, by the way, I want to bother talking about because I think, just like anything else, the world in child welfare is kind of cyclical, and the pendulum swing and all this kind of stuff gets revisited. There are so many things that happened in 2004 that I'm going to argue in hindsight we may not have done right. And here we are again with many of the same opportunities and challenges and pressures right before us. And so it's sort of taking stock of what did we learn and how can we do it differently and be more productive and strategic with our response. So let's talk about a little bit what happened in 2004, it's a sort of an important year for us in our child welfare system history. Again, remembering that we didn't really have data, really rich data prior to the late 90s and 2000. So this represents a good chunk of our history to the extent we had data to represent it. In 2004, we had about 12,000 children removed. We had close to 15,000 children in our foster care system. At current, that represents the peak of our foster care population. We had this implosion, and that's what represents that top peak right there. One of the sort of narratives to take away from this particular example in 2004 is this thought, it comes from that emotional urgency, I think, this idea that foster care is the way that we save children. And that we save children from their families, and children are going to be safer in our state protective custody than they are at home. And so this idea of we can just save all of them and bring them all into foster care and feel better about what we're doing by way of safety. Not in fact true. In 2004, we had the highest number of children in our foster care population, and we had really poor safety rates. And that's an interesting thing to try and reconcile. But 15,000 roughly almost children in foster care on any given day, and we had a re-abuse rate, that 6-month re-abuse indicator, that was 6 times the rate of today's. So, no, this is for all children. In 2012, you see, by the way, the sort of, again, the thick blue line, you see this kind of precipitous decline in our foster care population. We'll talk more about the sort of policy and practice trends that drove some of that. But from a data perspective, for comparison purposes, what you see in 2012 is that we had about half as many children in our foster care population, real intentional decline. And you also see that we had an improved safety rate. What this tells us, and this was very much driven by kind of a national push of which Georgia participated, is really about the safe reduction of the foster care population. This comes back to the values framework, and Governor Deal mentioned some of this. It goes back to that value we all hopefully adopt, which is that children belong with families, not in the state. The state inherently is never going to be the same as a parent, as one of us. And so fundamentally, we want foster care to be a limited intervention, reserved only for the children for whom it has to be necessary, because it is disruptive and traumatic and terribly harmful to remove children from their families, even when it's bad at home. And then when we bring them into this system, we want them to only be there for as short a time as possible, before we can make sure they can be with a family, their own or a different one, safely. Right? So it's a limited time intervention, and it's about moving children to families. Our goal is families for children, not just foster care. So you saw that values framework kind of go into action there, and that was some of the change. Let me put a little bit more context to it. And this goes, Stephanie, it might have been your question earlier. This goes a little bit kind of what are the stories behind these numbers? What drives some of these peaks and valleys over time? This may or may not be exhaustive of all of the things that were changing at the time, but these are interesting narratives to kind of note where the policy world was on this. In 2000, we had the case of Terrell Peterson. How many of you remember Terrell? Everyone, so no need to necessarily go into that horrible case, right? Put Georgia's foster care system on the cover of Time magazine as the shame of the nation's foster care system, put us all on Oprah's couch, and not in a good way. And so there we had Terrell, and Terrell was a case in many ways, again, having similar characteristics to some of the cases we've both most recently been dealing with in the media. He wasn't in foster care. He should have been, right? There was a misjudgment there. Something went wrong in our ability to assess and intervene with that family. Now, the practices were very different then. There were lots of things that were different. Fundamentally, that decision was what went wrong, just like it's gone wrong and does go wrong on occasion. So we had Terrell. In 2001, because of Terrell, we had a governor's task force, not unlike those of us sitting here today, hopefully different in terms of many things, but they did a lot of great work. They came out with a whole host of recommendations. Some of the things we're continuing to work on implementing today, the call center being one of them, actually. P.S., policy work and changing the tides of these things takes time. It's not really something we can do instantly.
Right, they came up with a recommendation for a call center in 2001.
Yes.
Just now implemented.
Yes. Because it takes resources, we had leadership changes, there's a culture shift that has to happen, a socialization of that issue from the sort of decentralized local control to a centralized state control idea. All of those things and many more interfere with the ability to do something quickly.
Do we have the list of recommendations from them?
I can get them for you. I have them. Mm-hmm. So there was a governor's Blue Ribbon Task Force that issued a number of recommendations. We had the first round of the Child and Family Services Review. That is, in brief, a really vigorous federal audit of our child welfare system and all state systems. It's required by Congress as a result of some of the laws that have passed. It's what's driven our systems towards a more outcome-based system. Every state goes through it. Every state failed the first round, including Georgia, but lots of pressures, lots of reprioritization that came from this. We had to start to define our work the way the federal government defined things because there were federal penalties involved, et cetera. So big pressures that came from the CFSR about in 2001 while all this other pressure was coming down. We had the House of Prayer. Do you remember that case? Reverend Allen. That's actually only recently, I think, come to a conclusion in terms of a natural. That's right. That was Judge Walker. So we remember House of Prayer again. Cheers to you. So another high-profile case, right? Lots of pressures on our system, lots of reprioritization of our system, and the then governor provided another $110 million in funding as a way to help sort of increase the workforce to respond to some of these pressures. What happens when we just increase the workforce? We have more people. We have more people on the ground, and they're reacting from a place of fear and pressure, political, public, otherwise, personal, the feelings we have about all of this. And they started removing, and I'm oversimplifying, but they removed every child they saw, right? We feel those pressures. We're not able to make those critical judgments, and I've made them. So I can tell you, right? Those investigators, those caseworkers are working in a world of incomplete information and imperfect circumstances to say the best, right? And it's all the things Judge Walker was saying about how much more information comes out. These families are always more complex than you know. They're not exactly cooperative all the time, right? They're not eager to see you. There are all kinds of things that frustrate that ability, and then we have the resource issue about getting families referred to services and having services that are actually individualized enough to help, et cetera, et cetera, et cetera. And you have here a workforce that's in that primed in that kind of way, working under pressure, and so the decision just became the default. We're just going to remove children because we're under all these pressures that DFACS is not able to keep children safe. And you start to see the increase that led to this huge population in foster care in roughly 2002 to 2004. What happens then? We exceed the ability of our foster care system to serve the children in it. We stop being discerning about which children foster care should be reserved for as an intervention, who should be there, who shouldn't be there. How do we make sure we keep kids at home safely, because we weren't doing that, we were just removing kids. How do we move children out of our foster care system when we're just trying to manage the fires at the front door? And so at the end of the day, we have a foster care system that's broken. And so we have a class action lawsuit that told us our foster care system was broken in many, many ways. So we have the Kenny A class action lawsuit that was filed in 2002. Again, really a lot of pressures brought down the state. We're still working under that consent decree. It's still very much defining some of the priorities of our work. It's still consuming resources. And then in 2004, there was a distinct policy changed by the then leadership at the time of the agency, which was, again, reacting to some of these pressures, made a decision that every report made to the department by a mandated reporter, all the people who are required by law to make reports of child abuse, doctors, teachers, counselors, all that whole array of folks, that every report made by a mandated reporter had to be fully investigated. Now, about 70% of the reports made to DFACS in any given year are made by mandated reporters, primarily from the schools and medical settings, hospitals, et cetera. DFACS has a professional role here to exercise some judgment and ferret out which of those warrant an investigation versus some other kind of response versus a screen out. This removed that discretion. And so we were deploying the workforce that we did have under all of these pressures and using them perhaps in an inefficient, at minimum, way. So all of those things are what contribute to that peak, to your question. You saw the corresponding uptick in the CPS calls as well. And so you see that every CPS call we had, right, we just took a kid in, basically, I mean, not exactly one-to-one, but you see the relationship there. And the other thing you don't see here is also during that period of time, there was an infusion not only of state money, but also of federal money. And so many, many states saw this, a similar kind of trend. And so then the policy world sort of responded and then introduced an initiative around the safe reduction, going back to this value system of foster care is not where we parent children forever. And so we need to figure something else out and develop some strategies. And then you saw strategies like what we, again, call family support here. Ways that we can strategically and effectively manage who comes into our foster care system, that we have alternatives by way of dealing with families and children in their communities, that we also, for those children who are in our foster care system, have very intentional strategies about moving them out to families as soon as we can, right? Through adoption, reunification, all of our other options. So there was some really intentional work done there and some new practices developed, new initiatives in our state and every state.
Okay, here's a question.
Yes.
When you had this 14,500 kids in 2004,
Yes.
I mean, were they the same placement types? I mean, non-relative foster?
It's a good question. I think it's fair to say they stay roughly the
Relative
same.
foster, the institutions?
Yeah.
Because we went away, like out where I live, I remember, Brenda, you remember when they closed Brook Run?
Yeah.
Mhm.
We went away from the concept of the institution
Yeah.
and just shut that thing down, much to the chagrin of a lot of people at the time, and we shipped kids to Milledgeville and all over and stuff. I mean, that's why I asked if,
Yeah, I think that that's a fair insight, and I would guess that the data would show that we probably would have more children in congregate care settings. What we saw by way of some of this enlightened movement of the more modern child welfare, if you will, as well as specifically in the Kenny A settlement, was real pressures on keeping kids out of congregate care settings, if at all
that's one of the
possible.
reasons-
Age
That's one
restrictions.
of the reasons that happened,
Right.
in that lawsuit, I remember.
Right.
Okay.
Right, and again, reflecting back to the values framework of children should be with families. Now we have these interesting, I don't really know how to, I wouldn't call them, they're not hybrids, but they're kind of interesting new bodies that have come up, right? These new placements where we have house parents for children so that it resembles more a family foster care situation, but they still are kind of in that quasi-congregate care setting. So we have kind of new creatures of invention, right? Necessity breeds invention that have come online as well, and those are sort of fill that space a little bit too.